On Friday, September 11th, we identified 105 new cases, and the provincial lab completed more than 12,700 tests. For Saturday, we identified 173 new cases. On that day, our lab set a new record by completing 18,919 tests. Finally, yesterday, we detected 140 new cases and conducted 14,451 tests. I want to take a moment to recognize the significant efforts made by Alberta Precision Laboratories and Alberta Health Services teams over the weekend to bring in extra staff for surge capacity to tackle the backlog of samples. We should not expect daily testing to reach 19,000 tests per day. This has never been our goal, to reach this level on a daily basis. What it does show is the dedication of these teams to help reduce lab testing turnaround times, and this past weekend is one more example of all the work that is going into improving that metric. Although our confirmed case numbers from Saturday and Sunday are somewhat higher than they have been in the past while, put in context of the over 33,000 samples run in these 2 days, these identified case numbers are still manageable by public health. As of yesterday, we had 37 people in hospital with COVID-19, with 7 of those in ICU. Sadly, I must also inform you that one more death due to COVID-19 happened over the weekend. To date, there have been 254 lives lost in Alberta to COVID during the pandemic. Each one is a loss for their friends and family, and I know that many throughout our province continue to grieve. Many others have lost loved ones to other causes as well, and every death, no matter the cause, leaves a gap that we must grieve in different ways than we are used to, given pandemic precautions. My sympathies go out to all those who have experienced loss and grief in this time. Another toll on Albertans has been increased anxiety, as we are all faced with living in a time of uncertainty. We have heard that this is impacting students and teachers with intense scrutiny on school reopening. I want to be very clear that we continue to act quickly to limit the spread of COVID-19 in schools, and that our commitment to transparency in reporting should not be seen as a heightened risk of COVID-19 in school environments. With community transmission levels higher in the past few weeks, it is not surprising to see some cases in staff and students of schools. We continue to identify cases in all sectors of our society. What matters are the interventions in place to prevent spread in the school environment. We will be closely monitoring these interventions to be able to make any necessary adjustments if needed. As of this morning, Alberta Health Services has confirmed 42 cases that were present at 35 schools while infectious. Since Friday's update, we have confirmed 3 more school outbreaks, none of which have been shown to be associated with in-school transmission. The new outbreaks were identified at Lester B. Pearson High School and Auburn Bay School in Calgary Zone, and Ross Shepherd High School in Edmonton. All parents and guardians at these schools were directly notified by AHS and the school over the weekend, ensuring that they had the information they needed before school started today. We have now updated the school map to keep Albertans informed as well. As I mentioned last week, while we are calling these outbreaks, it is important to keep these in perspective. We recognize that it's important to act quickly when cases of COVID-19 are identified, which is why we are treating only 2 cases who were in a school while infectious within a 14-day span as outbreaks. This is a very cautious use of this term. As soon as even a small number of cases are identified, all necessary precautions are put in place within a school. We believe this is important to containing the virus before it has a chance to spread. However, 2 cases is also an extremely low threshold to meet, especially in larger schools. I want parents to understand that notification of a small outbreak is a sign that health officials are acting quickly and doing everything possible to support students' health and learning. What's important to know about the number targeted for a single day is that we need to have surge capacity. So we need to have the ability to move through 20,000 tests in a single day if we should need to. And as we're looking at the fall, we know that we need to be able to move into a surge capacity if we should get increased circulation of other viruses like influenza, if we should see an increased spread of COVID-19, that we do need to have that ability to test that many people in a single day. But there's a difference between surge capacity, being able to test a certain number of people in a particular day, and the requirement to test that many people every single day for months and months. And so I think that that distinction has perhaps been lost, but what we need to do is we need to have that surge capacity. So absolutely, as the lab has demonstrated, we have that surge capacity that we committed to having, but we do not need to maintain that capacity every single day. Again, we need to focus on moving our highest priority samples through as quickly as possible, those who are symptomatic, those who are close contacts of cases, those who are in outbreaks. And if our case numbers should increase and we should see more symptomatic individuals, we absolutely need to be able to surge to that, which, as I've just said, we've proven that we can. But the intention has never been to have that kind of a sustained capacity every single day. One of the challenges of asymptomatic mass testing is that it can pick up individuals who perhaps had COVID-19 maybe a month prior, perhaps they're no longer infectious, but they still could test positive if they're shedding the virus. And so one of the challenges, again, as we're doing the asymptomatic mass testing is to distinguish between those who perhaps are infectious, currently actively infectious, and those who maybe had infection a while ago. And that, I can't comment on exactly what the Ontario's Deputy Chief MOH had been commenting on, but that is one of the biggest challenges of that mass testing. What we've seen from our mass asymptomatic testing in Alberta is a very, very low positivity rate. So we're looking at around, when you look at thousands of tests that are done across Alberta every day, we're seeing on average only about 6 cases per 1,000 people tested, which indicates, again, that the risk of someone being actively infected when they have no symptoms and no exposure is very low. And so that's not what's driving our case numbers. Our case numbers are being driven by those who are symptomatic, by those who are close contacts of known cases, and by those who are involved in outbreaks. The number of total cases we're seeing through our asymptomatic testing is a minority of our overall cases. And again, to get our economy restarted, we can't ignore COVID-19. We have to hold two things in balance. We do need to move forward with all those things that support Albertans' health, the ability to work, the ability to socialize, the ability to engage in activities that keep people healthy like exercise and recreation. And we also need to keep COVID-19 restrictions in place to the level that allows us to have all those other things that we need for our health, as well as minimizing that transmission, because we know that if transmission rises in some other places around the world, that causes significant impacts on the economy. So in order to have both of those things, we need to work for that balance.